special guest today is Mr. Eric Schultz, who's the president and CEO of Harvard Pilgrim Healthcare, which has been rated #1 in private health plan by the National Committee for Quality Assurance. Let's meet him today and find out his journey. Mr. Schultz, welcome to the show.
Thank you.
Thank you.
Good to be here.
So, you were called one of the most 50 influential Bostonians by Boston Business Journal. But your journey didn't start in Boston, right?
Right.
So tell us something about your childhood. Where were you born and something about
Sure. Well, I was born in Philadelphia, which is the land of brotherly love,
Right.
as it's called. But I was raised in Connecticut by my mother
Okay.
and her sister, and I'm the youngest of four. And we had a wonderful childhood filled with love and education, not so much economic means. We were supported thanks to good social support and welfare for a period of time, but it really was the love and education and guidance that made a difference
Very
for all of
inspiring.
us.
Very
Yes.
inspiring. So I read that you are on the board of Boy Scouts.
Yes.
Right?
Yes.
And you are a distinguished Eagle Scout.
Yes.
Right?
Be careful, this eagle
that
may.
is that
We-
is the one. Okay, that's the distinguished Eagle Scout, and you have also you also got the outstanding volunteer service award from the Boy Scouts of America. So tell us how you got involved in that, and how did that influence your journey later on?
Sure. Well, the Boy Scouts are very important to me, which is why I try to give back now as an adult. Going back to my childhood, my mom knew that both my brother and I would need the guidance
Right.
that and education that the scouting program could offer us. Many times children ended up on that side of the track, as we call it, or on the good side. So Boy Scouts of America gave me a foundation in values, in leadership, and in respect for one another and for everyone.
And are your sons involved in that
Yes,
too?
our sons were very involved. My wife was very involved.
Okay.
And both of my sons, I'm proud to say, are Eagle Scouts, and I think very good citizens.
That's wonderful.
Yeah, we're proud of
Now,
them.
you have an MBA in healthcare leadership,
Mhm.
and you also did a BSc in biology and BA in economics.
Mhm.
What got you interested in healthcare to begin with, and at what age?
Sure. Well, my mom was a nurse.
Okay.
And
okay.
so just growing up around a nurse and healthcare was the start. I wanted to become a physician. I worked in housekeeping at a nursing home when I
really?
turned 16. My
Okay.
mother said I needed to learn humility before I learned
Oh my
medicine.
goodness.
I went to school at University of Connecticut thinking I'd want to become a
Right.
physician.
Right.
My path didn't lead me in that direction, but I loved biology, and I fell into the track of healthcare business, really, later in my undergraduate career.
Wonderful.
But always loved healthcare.
Yes. And you worked with several of them, right? From Prudential, Cigna,
Yes.
Fallon, and you came to Harvard Pilgrim from Fallon Healthcare.
That's right.
What brought you to Harvard Pilgrim?
Well, I was leading a physician group practice in Nashville, Tennessee,
Right.
and it was affiliated with Prudential Healthcare. There was a change. Prudential Healthcare sold a part of that business, so I was looking for a new opportunity. And my wife and I said, why don't we look back home in New England? And this opportunity was available at Fallon Community Health Plan. And I know I was able to get that job because I had worked both on the insurance side and also on the clinical care delivery side. And Fallon, as you know,
Right.
is a integrated system as it was. It's now two separate systems. And that was very important. It was very meaningful to my career and my thinking.
So Boston Globe called you a pragmatic warrior, right? After you cut a deal with the state regulations,
Yeah.
right? So what are the qualities that you think you have that make you a great CEO? And what are your biggest contributions to Harvard Pilgrim, you think?
Well, I'll leave titles of a great CEO to others to
Okay.
decide for themselves, but I
Sure.
think what I try to do to be an effective leader
Okay.
is to be informed, have information, facts,
Right.
and to create an environment of open communication. because I think in order for us to advance through any challenge or opportunity, we need to have the facts and we need to have the ability to sit down and have an open conversation about where we want to go and how we want to get there. So communications is so important.
Absolutely.
In so many things that we do, healthcare, patient-physician relationships, inclusion, in strategic planning of our organization. I think that's key.
Okay. And what do you think you have changed the most in Harvard Pilgrim since you came on board?
Well, I think Harvard Pilgrim has changed me a lot. Our people, our mission, our board, in so many favorable ways. But I think one aspect that I'm proud that I've brought to Harvard Pilgrim is a sense of and respect for the healthcare delivery system. And there's such a great opportunity for health plans like Harvard Pilgrim to work differently and more effectively with physician practices and hospitals. And our focus here strategically to embrace that differently over the long term, I'd like to think is a strong aspect.
And you have been voted one of the best places to work at, right?
We have, and that speaks to the people.
Right. So you've been very supportive of the South Asian community and all our endeavors. You have supported Health Expo, our Mega Health Expo. This is our 3rd year. I'm also a part of Saheli, which is a big organization. It's Friendship for South Asian Women in this community. And we did a big program here, which was only possible because of Harvard Pilgrim. It addressed important issues like domestic violence and also emotional well-being. So tell us what got you involved in the South Asian community and who inspired you?
Sure. Well, first thing I would say is I think the work of the Saheli organization is just fantastic. And I think it also speaks to the point I made earlier around communication, because the organization is creating an environment and programs to talk about something that's very important yet taboo, and to do it in a way that's respectful but open and informed. So how did I become interested, involved in the South Asian community? The first step, a significant person in my life was and is Dr. Baltej Maini. Baltej Maini was the chairman of the Fallon Health Foundation and Fallon Clinic president, and he hired me into the role of Fallon Community Health Plan CEO. And my wife Kim and I went to India with Baltej and his wife Indira, and we spent a couple of weeks learning about the healthcare system, but also enjoying the culture. And we were there during Diwali and celebrating the holiday with Baltej and Indira and their family, losing to cards with the young ones.
You have to celebrate Diwali with us here.
That's
in
right,
New
I know
England.
it. As long as you have sweets. I have a sweet tooth.
Yes, we do.
But anyway, it was during that 2 weeks that I learned, I was immersed in a culture that I didn't know. And I learned a lot. And I came back home here to the States having a comfort in understanding the culture and the people, and then feeling very comfortable and knowledgeable to open up conversations and be more curious. And it really began then and kept leading me along this journey, realizing that as an insurer, we have an opportunity to better connect with the South Asian community.
And you also, one of the things I like about Harvard Pilgrim is that you also have a Culture Insight program.
Yes.
Right?
Yes.
Which is, I don't think anybody else has that.
Not that I'm aware of. It's a wonderful program that speaks to understanding cultures and learning about them and teaching about them as it pertains to healthcare.
And you're also going to start the Health Equity Initiative in 2016, right?
So we have some new initiatives, but this is an area that we've been working on for over a decade, measuring where there is unequal access to care and then implementing programs to close the gap.
Two things which really delight me apart from all the things that we talked about. One is that, of course, it was founded by physicians and continues to involve clinicians, nurses, and physicians as leaders. And secondly is your the way you have done some of the unique things for example, we tell our patients to eat right, but you actually have Eat Right Awards, right?
Yes, yeah, Eat Right Rewards. It's hard to say.
Right, rewards, yeah. So you want to tell us a little
Sure.
bit about that?
Well, you know, what we try to do as a health insurer
Uh-huh.
is to create programs that reinforce what the physicians try to do with their
Right,
patients.
right.
And we created a program called Eat Right Rewards. It's voluntary, and it's very simple. And what it does is if you belong to a grocery store, frequent shopper, and you have a card, you register the number,
Right.
and then whatever you buy, this program will assess all of the items that you
Right.
purchased and give you a score of 0 to 100.
And
the program actually offers financial incentives if you
absolutely, I
participate.
saw that,
Right,
right?
you can get some
$20
money,
there,
right, as well as
right.
coupons that you
That's
may not be able to
wonderful.
get. So it's
I was
it's
so impressed
fun
with that.
and it's rewarding.
Right, right. That
Yeah.
was a very unique thing I saw, because I know
Thank
a
you.
lot of health plans, they do give you initiatives for joining the different fitness
Right.
clubs, but this was something very different.
It's very different, and some people think it's Big Brother looking over our grocery cart. No, not at all. If you want to do it, it's voluntary, and you get
Yes,
great
but
rewards.
the Big Brother is giving money back. So
That's
people
right.
don't want that.
That's right. That's right. But it's voluntary, and have fun with
Right,
it.
right. So tell us something about your family.
Mhm.
Your wife Kim and your two children. You have two sons, Tyler
Yes.
and Cody, right?
Tyler and Colby, very good.
Yeah.
And my lovely wife, Kim, it'll be 30
Yeah.
years. We've
Oh
been
my
married on
goodness.
June
Tell
1st.
us where you met her.
Oh, well, you know what, Kim and I met on the job. It was a workplace romance.
Okay.
And it was in Atlanta, Georgia, back in, on Valentine's Day
Oh my
of
goodness.
1983. So it's gone by fast, but we both did the same job, paid claims, medical claims.
One other celebrity told me he met his wife on Valentine's Day.
Oh, yeah?
That was Farid Zakaria in
Ah,
Boston.
Excellent. I am a big believer in Valentine's Day, and
Okay.
I'm a big believer in workplace romances. How's that?
So let me ask you a question which I ask all men. So
Okay.
what was, all married men.
Uh-huh.
So what was the first thing you liked about your wife?
You know, I've got to tell you, it was when she walked by me, my heart skipped a beat, and I remember the perfume she was wearing,
really?
and I could see what she was wearing that very minute. She walked right down the aisle.
What
so,
was she wearing?
I cannot tell you, because I don't want everyone to rush out to the store and buy it.
Okay.
Love at
And
first sight.
That's wonderful.
But I thought she was out of my league.
Really?
Thank God. You know, she was a cheerleader. I was in the marching band. You know, those are cultures that didn't cross back then. Anyway, we had
They're
fun.
together 30 years
That's
later,
right.
right?
That's right. I'm the lucky one.
And what do you think keeps, what are some of the best things that keep a marriage together?
You know, and this is what Kim and I say to our children, is hopefully we're all fortunate enough to find someone in life that we enjoy being with, and that we have things in common. And I believe that it's that which sustains any relationship for many, many years. When you enjoy doing things together, you respect one another,
Right.
and you learn from one another. And I'm also a big believer that we don't all have certain roles, but
Right.
rather we sit down and we figure out where do we fit in our particular marriage, and what do we like to do in the other one.
What is the best advice you got growing up from your family? Your mom, for instance.
Best advice, there's so many aspects to that. I have to think one was to take risks.
Take risks.
Mm-hmm. Yeah.
And yet you're called pragmatic.
Yes, I think you can be a risk-taking pragmatist.
All right. So, and what is the best advice you've given to your children?
Don't do as I do. Do as I say. You know, thank you for the question. I would say is to find a job. Both of them, they're 25 and 27, so new to their careers. But find jobs that they love.
Okay. And
The
what have
work.
they found so far?
Interestingly, and I've had nothing to do with either of their
Uh-huh.
jobs, but one is in healthcare policy
Okay.
in DC, and one is in medical informatics. in Waltham.
So the apple has fallen right
Yeah,
next to the tree,
it
right?
has. I'm glad they're in healthcare. I think it's a great industry, but I think me dragging them around to all these events when they were kids had an impact on them.
That sure
Yeah.
does. That sure does. Now, do you have any plans to follow Charlie Baker?
If I run for office, it would be Senate rather than government.
Okay.
No, I get that question a lot.
Yeah?
Yeah, yeah.
Right. Right. You have all the
I love
ingredients
politics,
for it,
though.
you do.
Yeah, sure.
Okay.
I think it's important. I admire anyone that is willing to put an investment of their life and their career and their family.
So if you run for Senate, we want to be the first to know.
Okay.
For the South
Sure.
Asian community.
Right.
Right?
I love my job here. I don't plan on leaving Harvard Pilgrim anytime soon.
I think right now they
Not
need
voluntarily,
you. Right,
anyway.
Right, right. So,
Thank you.
let's ask you about some of your favorites.
Mm.
Okay. What's your favorite book?
These are tough questions because they always evolve. But you know, one book I read, which was written maybe about a decade or so ago, is called The Devil in White City.
I haven't read that.
Yeah, and it's a little bit of history and a little bit of drama, and it's revolves around the World's Fair
Okay.
in the late 1800s, and it's also a murder mystery.
Oh,
I won't say
I like
anything
it.
else.
Okay. It's your favorite movie.
My favorite movie, I tend to go for futuristic movies, but you know, I love The Matrix.
Matrix.
Mm.
Now, on your trip to India, did you see any Bollywood movies?
No, but I did hear a lot of Bollywood music.
We have to introduce you to some Bollywood movies. If you want a glimpse in Indian culture, Bollywood it is.
It's true.
Food and Bollywood.
Yes, yes.
So, and music, of course. Now, what's your favorite song?
My favorite song,
Or a favorite band?
you know, I'll tell you, and that's changing a lot too, but I would say, right now I'm into, some of Swedish House Mafia, yeah.
Okay.
Mm,
Did you like ABBA when growing up?
yeah, ABBA was good. I was
You are
more into
Swedish.
Pink Floyd and Alan Parsons Project, but, I'm all over the board when it comes to music.
Okay. Do you have any favorite quote?
I do. Actually, one is, and I won't bore you with the long quote, but it's by Calvin Coolidge, one of our presidents, and his quote was on the value of persistence.
Okay.
And any of the viewers of this program, I would say, Google Calvin Coolidge persistence.
Persistence.
Mm-hmm.
Okay. That I have to do.
Okay.
Now, who do you think, I know you mentioned your physician friends, but who do you think has inspired you the most in the world?
I would say my aunt.
Really? Tell us about her.
So my mother and her sister raised the four of us children. And my mother was just incredible, and as was my aunt. They were really two mothers to us. My aunt was the one who I think gave me the value of curiosity, being curious and asking questions and taking risks. And she would take us on long hikes and teach us things. She would teach us don't ever let the fact that you don't know how to do something stop you. Figure it out. Relearn. And it's basic, but it's really quite fundamental in who I am.
What's your favorite hobby?
Oh, my favorite hobby.
We know you love politics now.
Yeah, I would not call that my favorite
No,
hobby.
okay.
It is interesting. I would say my favorite hobby these days is landscape design.
Really?
I'm very visual, and I like taking something and designing, and I've always enjoyed gardening and things of such. So, yeah, that's a lot of fun.
Do you get time to garden though?
I do.
Yeah.
We moved to the city from the
Okay.
suburbs, so my gardening has shrunk in size, which is good.
And what do you like to grow?
I like to use annuals and then change them a couple of times a year and think about designing with them. And I also love planting fall bulbs and seeing them come up.
It's
And
very
aren't we
relaxing, right?
aren't we ready for spring?
Yes.
This
we
year?
are. Especially this year.
Oh my gosh. Ah.
So, do you like to travel?
Love to travel.
Travel.
Oh my gosh. Yeah, I love adventures. And I used to tell the kids we're going on an adventure, and we wouldn't tell them.
Really?
We tried to give them the spirit of
So give us
travel.
some examples of those adventures.
Well, you know, it was usually here in the States, but we
Uh-huh.
would have a sport utility, and I'd put a mattress in the back with blankets, and I'd say, we're going on an adventure tomorrow, and I wouldn't tell them where, and I said, I'm going to scoop you out of the bed at 4 a.m.
You probably stayed
They
up all
loved it.
night
They
anyway.
did. And we would go on trips, you know, whether it was
Really?
to D.C. or Niagara Falls, or,
So
you know,
wonderful.
not that far, you know, or to visit friends in Florida. Yeah.
Uh-huh. And what's your most favorite travel destination?
There are many. I would
Tell us
say, Kim and I have talked about this. We had a wonderful time in Paris. We've only been there once. It was perfect weather. It was about a week and a half. It was romantic, as we all read about, and historic, and the museums and everything. It was beautiful. Yeah, I'd have to say that right now.
Okay, okay. And is there any place in the world that you would really like to visit?
Well, I want to go back to southern India, and I'd love to take the train, Orient Express, across southern India.
Wonderful.
I was in Bangalore with a fellow business colleague of mine, and it was so different than northern India.
Absolutely.
And I want
It's
to.
like north and south here.
It
also.
is.
The culture is
It is
so
the
different.
people,
Right.
everything, and so that's what I'd love to do. I love the train.
You should go on Palace on Wheels then in India.
Is that what it's called?
Palace on Wheels is North India.
Mhm.
Starts from Delhi and goes to the state of Rajasthan.
Ah,
So that used to belong to Maharajas.
there you
So
go. Well,
Palace
it's,
on
yeah,
Wheels.
lots
So-
of good things to see
Yes,
along the
and
way,
eat.
right? And eat. See, it's travel and it's food and it's culture
Yes.
all in one.
Do you like Indian food?
I do.
Then can you eat the spicy food or just the sweet?
I can eat spicy on a scale of 1 to 10, up to about a 7.
That's pretty good.
Well, you know, my son is definitely a 10,
Really?
my younger son, but yeah.
I'm getting very impressed with it.
I don't know, but my scale is probably very different than
You
yours.
have to come to our Indian events now. Just supporting the event is not enough. Now
They-
you have to come and be a part
Come and
of
eat,
it.
all right.
So come and eat. And is there, if you could go back in life
Mm.
and fix one thing, what would you do? Or do something differently?
Right, right. That is that's a thought-provoking question, thank you. You know, I would want to have an impact on, I think, race relations. And thinking about the history here in America and understanding the value of inclusion,
Right.
I would want to go back well into the slave trade era and try to influence changes
That's wonderful.
to that.
That's wonderful.
Yeah.
That's wonderful.
Yeah.
So that brings me to, what do you want to achieve in the next 10 years?
Mm. You know, I hope that from a professional standpoint, because there's personal and professional on
Right.
that, I want to continue to serve as leader of Harvard Pilgrim Healthcare and to use this wonderful asset
Right.
to truly impact the value of healthcare. We spend a lot of money in the United States on healthcare, and it's not producing the kind of outcome
Right.
that we should be producing. And it's easier said than done, but I want to look back in the next 10 years and say that I had a meaningful impact of helping to create greater value in our healthcare system.
And you've created something very unique with the Eastern Harmony
Yeah.
sense of well-being too,
Mhm.
right? This is a new initiative
It
since
is.
you started, right?
Yeah.
Okay. So that brings me to the last question. What's your last word on Chai with Manju?
Oh, my last word. Oh, well, first of all, thank you for having
Thank
me.
you for coming.
It
Thank you for
is
coming.
a
Means
real
lot.
pleasure to see you
Thank you.
again and to be with you, and to have an opportunity to share some stories.
Okay. Thank you so much.
Thank you.